Hello, good evening. How are you doing? Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. My name is Dr. Frederick Unwigohai, and I'm the host of your program today. How are you? And where are you watching me from? Now, on today's program, we'll be doing a question and answer session. Some people asked me last week and they said we should continue the question and answer session again this Sunday. But remember, on this platform, we would not treat you, we would not make any diagnosis for you. We always tell you to go to the hospital and speak with your doctor. But if there's anything that is not clear to you, something you want to clarify, something you want to ask, please feel free to drop your questions and I'll respond. My co host is Dr. Israel, and my co host is going to join us very soon. Remember, we don't give our number online, we don't do private chats. Yes. So I'm live on YouTube, I'm live on Facebook, and I'm live on TikTok. Yes, Grace, good evening. How are you? I'm live on TikTok, on YouTube, and Facebook. TG Ogame, how are you doing? I see you. Good evening. Happy Sunday. Ruth Ademola, Ruth, how far now? How are you? So if you can hear me and you can see me, I just want you to say hi. I can hear you, I can see you, and tell me, where are you watching me from? Where are you watching me from? Let's go. Talk to me. Where are you watching me from? Ah, okay. Now, if you have any questions, please drop your questions now. Not that when we now start, you now say this guy does not want to respond to me. He's ignoring my questions. No, I'm not ignoring your questions. Sure you get. Okay. Ask me now. Let's see. It's an open day. You can ask anything actually. Anything. Happy Sunday, Maureen. Maureen, how is Plateau State? I never knew you were in Plateau State. How is Plateau State? Harris. Harris, how far now? Olaoye Wasiu. I'm watching from Ebute Meta. Oh yeah now. I greet you specially. How is Ebute Meta? Okay. Yes, yes, yes. So if you have a question, ask me your question. Sharply, sharply, huh? Ask me. I'm okay, and you? I'm good. I'm good. I'm good. I'm good. Watching from Cameroon. Somebody on TikTok is watching me from Cameroon. What's her name? Your name is NJTK. Okay, I see you. Yeah. Hussein, watching you live from Mina, Niger State. Oh yeah, ask me. Oh, who be this? Who be this? Who be this? Emilia Nathaniel. Emilia, I see you specially. Mr. Samuel Friday. Good evening, sir. Watching from France. Okay. So nobody get questions for me. Ha, this is good oh. I like this. It makes sense. So maybe just the mass if I get from Port Harcourt. From Port Harcourt, Port Harcourt. Okay. Ben says, I want you to explain the difference between AC and AS genotype. I have done that already in a video now. What's your name? Mr. Wasiu. I have done that already in a video. I already explained about AS, AA, SS, SC. I already explained in a video. So what exactly do you want? Ahem. Watching you from Lagos. Somebody says I get question. Oh yeah, ask your question. Mr. Moses on Facebook is watching me from Lagos. Mamana is watching from Libya. Hey, good evening from Tamale, Ghana. Mr. Samuel say they watch us from Lekki. How is Lekki now? Hope say Lekki is not flooded. Any hope for a patient with adenomyosis? When you say any hope, yes, adenomyosis, what's your name? Emilia. Adenomyosis can actually be managed. It can be managed. It depends on the severity, but yes, it can be managed. When you say hope, I don't really know what you mean by any hope. And I don't know if you have seen a gynecologist. If you have seen a gynae, sure, they will tell you. But if you never see, I think it would be important you see. So when you say any hope, what do you really mean by any hope? Watching from Oshun States, Oshun. Somebody says he gets question. Oh yeah, now drop your question on TikTok. Hmm? Make I see, make I see what I fit answer you. What I want to ask about ovulation. Okay, go ahead. Oh yeah, share this video. Mr. Franklin, Alaja, Alaja Nimotalayi. I greet you, Eka Lema. She's watching us from Osun State. Watching you from Festac in Lagos. Oh yeah, now ask now. Okay, let me see. Let me see. No questions for me. It's good. I like this. But my co-host is going to join us very soon. Oh yeah, share. Share this video. Share the video so that more people. Good evening, doctor. We can teach more than a teacher. No, you dey whine me. You whine me. How are you, Marian? Marian, good evening. I see you. Okay, let me see. Okay, let me see. Let me see. There's a question here. Good evening. What could cause one having pain and heaviness on my arm? Please, what should I do? Who be this? Adebayo. Adekunle. So, Adebayo, you are having pain and heaviness in your arm. Now, the response I'm going to give to you, the answer I will give you is very limited. Yeah, it is, go dey very big because I don't know a lot of things about your arm. But if you know, say maybe you do a job, you carried something, you did anything, you carried anything heavy, you fell down. That might just be the cause of your pain and the heaviness. But if you know you did absolutely nothing and you notice pain and your hand is heavy, you cannot even lift the hand. Listen, this one, wherever you dey where you hear me right now, see a doctor now. But if you know, say now something where you carry, maybe you fall, or you were involved in an accident, something like that. Okay. Now that thing fit dey cause the pain for you. So you can take analgesic, like a very simple pain relief. It will help your pain at that point. And I believe, say maybe you go don get one or two treatments in the past. So try and rest that hand. Sometimes you can do massage. But if you know that you did absolutely nothing, you dey feel that pain for your hand is heavy, or the pain dey waka, e dey move from your arm, e dey move to your face, the pain dey move to your face, then you should see a doctor now. Question. I feel heartbeats like I'm doing exercise, just like that, even if I'm sitting doing nothing. What would be the problem, sir? Okay, listen, listen carefully. This is not a consultation. So make sure you understand that everything I'm going to tell you here is not complete. Because I'm not meeting you. I'm not having consultation with you. But if you are feeling your heart is beating fast, you can hear your heart beating fast, even when you are not doing anything. It's called palpitation. Palpitation, that is your heart dey beat fast. Many things can cause it. Many things. It fit be from the heart, it fit be your lifestyle. If it be something where you don't do, maybe you know they sleep, you know they rest, the alcohol, you they smoke, something like that. Or if it be a heart problem, or if it be other problems from your body, hormonal issues, plenty stuff. Now, if this stuff you just notice this thing today, relax, don't panic. But if it has been happening to you every time, a long time ago, and you dey hear the heart beating very fast, you will need to do some tests. Oh, you will need to do some medical tests. Now, the test you will do or the test you will carry out is tied to so many things. Number one, it's tied to your age, it's tied to your body weight, it's tied to what we see when we check you, and many things. It might be few, it might be plenty. The test will check your heart, number one, and can check other things. And if you dey walk, you know dey rest. Maybe your body is giving you a sign for you to rest. So give your body a break. If you dey smoke and you're taking alcohol, they might also be triggers. But if you know you are not doing any of these things and you dey feel your heart beat every time fast, fast, honestly, you will need to do some tests so that we can know what is going on with you. There's no way to guess. Yeah, thank you. Somebody sent me Rose. Hey, Juliet Richard. My people on TikTok are here. Um, Good evening. Somebody's asking me a question on TikTok. Good evening. Please, can hepatitis B be cured? Hepatitis B. So hepatitis B does not have a cure, my guy. I'm going to post a video about hepatitis B this week, a very long video on YouTube and Facebook. It doesn't have a cure. It doesn't have a cure. But if your hepatitis B is in the acute phase, acute, about less than 6 months, sometimes your immune system can clear it. Can clear it. But if your hepatitis B has gone beyond the acute phase, it is now chronic, no cure. Some people go tell you say they can cure it. They will eat your money, they will deceive you, they will lie to you, and then when you develop complications, they will leave you alone. You suffer alone. So it doesn't have a cure. It's not a death sentence. I'm going to post that video this week. So make sure you follow me on YouTube and Facebook. Yes. And then later, maybe after like 5 days, I'll post it on TikTok. Okay, watching from Ibadan. Hi, is Ibadan now? Adenike. Good evening, ma. Watching you from Sierra Leone. Alimatu, I greet you specially. Oh yeah, make una share. Sikiru, Ayo. Blessing, I greet you. Good evening, sir. I am a twin. What are my chances of conceiving twins? I want to plan my next pregnancy and rest once and for all. And can I please go for cesarean section at 37 weeks? Okay. So if you are a twin, you have a higher chance of conceiving twin. You're a lady, you have a higher chance compared to somebody who is not a twin. I can't tell you the probability or the percent, but you stand a higher chance. If you want to plan your pregnancy, no problem. Sure, you have a higher chance. People who have twin in their family from their mother's side, or you are a twin, you stand a higher chance. Can you go for cesarean section at 37 weeks? Yes, you can. If you and your doctor you make that agreement and everything is fine, sure, you can. There are so many reasons for cesarean section. And one of the reasons is that you can also request for it. Yep. Okay. Now, una no dey share, una no dey like, but the questions are pouring in. Let me see if I can take one question on TikTok. Sunday Victoria, I greet you. Let me see. Does ulcer have cure? No, you know they follow me. I'm not going to respond to you. Sorry, my guy. Now only those where they follow are the answer. I beg no vex, my guy. Let me see. If you know they follow me, let me see who be this. Please, my whole skin is like there is fire inside my body. What should I do? So this person is asking us a question on TikTok. Make we take in question for TikTok. It says, my whole skin is like there is fire inside my body. What should I do? Honestly, you should go to the hospital because this one is not social media matter. You should be at the hospital right now. Hospital is where they treat people. so that we can find out what is happening, and then we fit prescribe medicines for you. uh, Before then, if you need to do tests, they go say make you do tests, but there is no way anybody could tell you say your whole skin is on fire. This is the problem. We are not magicians. That is how we manage human life, and I would encourage you to please, please, please go to the hospital. Make them check you now, now, now. Precious, how are you? Watching from Bonny Island. Hey, I really like your way of teaching. Thank you. Is there any treatment for gallstone without surgery? It depends, actually. It depends. There's what we call conservative management. On it depends on the stone you have, the size. You understand? It depends on many factors. The severity of your symptoms. Ehen. Other than that, if you no work, then surgery. Okay, Dr. Israel is in the house. Let's bring up Dr. Israel. Yeah, yeah. Dr. Israel, good evening. How you doing now?
Good evening. I am fine. Oh, sorry I can't come up with a camera today.
No, 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 no problem, no problem, no problem. It's understandable. Happy Sunday to you. Hope you are good. Hope you are fine.
Yes, I'm fine. The way when you said that, ask me, be like mental health question. I'm,
I may be your guy.
I'm
I
good.
may be
I'm
your guy.
fine.
Yes, yes. I'm asking you. I'm asking you as a concerned doctor. Okay. So Dr. Israel is in the house, and let's see if we can respond to so many questions. We are live on TikTok, we are live on Facebook, and we are live on YouTube. This program has been going on for more than 5 years. Every Sunday, we are here. Good evening. I'm calling from Venezuela, Caracas. Oh, that's nice. Please, what is the cause for constant headache after taking medication? Dr. Israel, you want to respond?
After taking medication, what kind of medication? Now, headache can be due to so many things, and some of this headache you may not even need drugs. You just need to rest. Um, some medication can actually still cause headache. So it now depends on the medication you are taking when they cause you the headache. Some can be stress. Stress can cause headache. Some can be an infective process. When you get some infection to the brain, it can come as headache.
Oh, Dr. Israel, in network. In network. Let's bring him back. Okay, yeah, welcome back. Continue, I beg.
Yeah, can you hear me?
Yes, I can hear you.
Okay, some can be an infective process. So when there's an infection, some persons can have headache. Mostly if the infection they affect the brain. If person can have headache. Some can be due to space occupying lesion. Maybe say something dey the brain when they drag space when dey the head when they drag space with the brain. So you can dey cause you increase pressure for the brain, and that can also cause headache. So it's for you to know. Some can be migraine as well. So it's for you to know the kind and wetin dey cause am. Then the best thing is to see your doctor. So if you which kind of drug you take, if na drugs, so they go might likely stop you those medication. And if na stress, they will likely tell you to rest.
Okay. Oh, yeah, welcome back, welcome back. You're back, huh? You're back.
Okay. If na eye dey cause the problem, they will need to tell you to do stuff is being treated. The
Dr. Israel network, they really show am shege. Okay, you're back, you're back, you're back.
Yeah, I think I don't open it. I say if na eye, they'll treat that and then the headache will go.
Okay.
So Dr. Fred.
Thank you. Yes. I get your point. Okay, now this person says long term cough. Test has been done, no TB. What else can I do?
Low what?
Long term cough. Person they cough for a long time. He said he don't do
Low
test.
what?
Long time cough. He dey cough for a very long time.
Okay, so cough. Okay. So when they cough for a very long time, you have done test, let me say genus part TB test, and they are saying that it's not TB. If it can become allergic, so you can try to know about your environment. It can be allergic or some other thing. So the best thing is to see a doctor that are specialized in respiratory system, and that's the pulmonologist. You see them, they will be the best people to tell you if you need any medication or if they get other things when they go do for you. Dr. Fred.
Yeah, thank you, Dr. Israel. So the questions are so many. The questions plenty. Well. Ah, God of heaven. Please let me see who's this. Please, how long can one wait after the first cesarean section?
Okay. And normally after the first cesarean session, if you can wait for up to 2 to 3 years,
Um, After the first CS, after your CS, most times we advise you at least try to wait for about 2 years. Try to wait. Sometimes maybe go wait more than that, but for proper wound healing and for your body to recover, women would not wait for 2 years and they would get pregnant again. And that does not mean we will chase you away, but discuss um, with your doctor. If you notice that you are pregnant after CS, please discuss with them. But at least 2 years. Okay, so many questions. How can someone cure hypertension? Adenic care. I don't know whether you dey follow us. Maybe you just dey come. We don't discuss hypertension like last month. We discussed we discussed hypertension last month. We discussed a lot. It's very long. Hmm? Very long. I go encourage you, try watch the video. Everything wey you wan know about hypertension dey there. Because number one, you cannot cure hypertension. You can only control your blood pressure to be normal. You can manage it. If you no manage am, those things wey Google or Google. ECG is a test that tells us about the electrical activity of your heart. Huh? It's a test that tells us about the electrical activity of your heart, whether your heart they beat well, or they beat well, they beat too fast, whether one part of the heart they overfunction past the other parts, whether some other parts of the heart they carry too much load, many things. So ECG is a test that we carry out to tell us about the electrical activities going on in your heart. Yeah, I don't try break them down for you to understand. So that is just the brief summary, but it's quite big. It's a very very deep area in cardiology. Okay. Some people say answer my question. Answer my question. I know they see their question by the way. I know they see their question by the way. Please check my question. I know they see your question. Your name is what? Smart C said this person. Who be this? Precious. I'm not seeing your question honestly. Um, I'm not seeing your question, so that is why I'm not responding. I don't see your question. Okay. Dr. Israel is back. Let's take more questions. Your question is not showing on the screen. Yeah. Good evening. Let me see more questions. Let me see more questions. Let's check. Let me see. Good evening, Eve Gloria. Hey, my person. How are you? My God. Dr. Israel.
Yeah.
Okay. I'm glad you can hear me. May we see. Okay. I dey check questions. Oh, okay. Good evening, doctor. Please, what can be the cause of painful mekwe, painful intercourse, like severe pain that is making mekwe painful instead of pleasurable, and also bruises when sucking my bobby, and what can be the solution?
Okay. For this person, you need to just go hospital. When you dey make way and you dey get pain, uh, one of the things when down they tell us is that there might be an infection, or even it can be as worse as something more than infection. Let me just say it like that. It can be something more than infection. If it's to be infection, now they cause am. And also, we know say other things fit still cause pain during mekwe, but the thing about the other ones now be say it can just cause pain from the beginning, but later the pain go stop. You know, can't dey painful again. But if you continue from the beginning to the almost to the end, you dey feel that pain. You know, say man, problem dey. It means say you need to go see your doctor. And if you be say that during sucking your body e dey get bruises, say that the person dey chop am, no be suck e dey suck am, or you get dried nipple, dry body wey be say as the person dey suck, instead of e come dey lead to all those bruises. So for all this, you actually need to see a doctor, make dem examine you, make dem look your body very well, so that dem fit do some investigation for you, then tell you some medication wey you fit take, and then by God's grace you will be fine.
Yeah, thank you. If you just dey come, you're welcome. Today is a question and answer session. We dey take questions and answer, but not every Sunday. But today we want to just take as much questions as we can. This program holds every Sunday, 8 to 9 p.m., and we have been here for more than 5 years. Now, somebody is asking us a question on TikTok. He says, what is the difference between anterior and posterior placenta in pregnancy? What is the difference? So the difference is just simple. It's not something you should cry about. You're just telling us that the placenta is in the front or at the back. Full stop. When you get belle as a woman, when you get belle, and the pregnancy they grow, the placenta go stay for somewhere in your uterus. If it stay for front of the uterus, if it stay for the back, posterior, if it stay front arterial. If it stay for up, it will say fundally sighted. Do you understand? And if it stay for up. But wetin we most times we no want, we dey really dey concerned about. Now when the placenta dey low lying, that is, e dey block the cervix where pikin go take come out. That one na very special one. But the placenta can stay anywhere in the
Well,
uterus, and e no mean say make you panic, make you cry. If it dey for posterior, if it dey for the anterior, if it dey for even superior or on top, might use that word for you. But most times anyone wey dey low lying, just dey ground, dey block that place, if it cause issues. But that is basically what it means. Yep. Okay. Let me see. Okay, we get a lot of questions on YouTube and Facebook, but they no dey share. Una no dey sabi share. Una no dey sabi like. Huh? Now, wow. Okay, Dr. Israel, let's take this question here. It says, good evening, doctor. What can make a grown-up boy to bedwet?
if a grown up boy bedwet, is either they not train am from small pikin make e not bedwet, or some can be some psychological conditions. So those kind of things you need to go hospital, carry the boy go hospital. And also apart from that, you also need to, depends on the age of the boy. I don't know the age. Oh. So you also need to retrain him on how to wake up. And another thing is for him to reduce the number of the number of fluid when they take at night as well. When you do all those things, most likely it will help the boy to stop to the bedwet. Dr. Fred.
Yeah, thank you very much. Okay, before we continue, I have a private community on Telegram. I have a private community. My people on Telegram, they vex for me. Say, why don't you talk about your private Telegram community? Tell them, let them subscribe and join. So, I'm telling you, if you are following me, wherever you're watching me from, on YouTube, Facebook, TikTok, anywhere, I have a private Telegram. You can subscribe to join. When you subscribe and join, when you click on the link to subscribe, you will see every reason why you should join, whether you need to join or not. Go click them, you go subscribe and you go join. If you don't want to join, no problem. The benefits, there are so many benefits for you. So the link is on my page on Facebook, on YouTube, on TikTok. Click on it, subscribe, and it's very, very cheap. Extremely cheap to subscribe. Yeah, but it's not compulsory. I beg. I'm not forcing you to subscribe, but if you want to join, it's free for you to join. Okay. Let's take some more question. Attend to my question. We know they see your question. I beg, my guy. I have chest pain and my leg is weak. My knees are weak. What is the problem? God, I beg go. Dr. Israel.
The problem now go hospital so that they go ask you further questions, and then they'll be able to tell you what your problem really is. There's nothing I can tell you from here that will give you the correct answer. Yeah? So when you get chest pain, you get weak leg and knee, you need to go hospital. Yeah? Just go hospital, see a doctor, may therefore discuss with you one on one.
Yes, okay. Let's take this question on TikTok. Ma see this question. Who be this? This person name now waiting. Born to win. Please, doctor, why? I beg, listen carefully. Why mild pain comes with itching and also burning sensation comes with itching inside? Your question no clear at all. I don't understand. But I want Dr. Israel. I don't know if you understand the question. Yeah. You say mild
I be
pain.
listening.
Okay.
Where the mind pain dey, na just the site na e no talk.
Mild pain
Where
comes
the
with
mind pain dey,
itching and burning sensation
itching.
comes with
And
itching.
burning sensation come with itching. So it's either they talk about microphone or they talk about pickles. One of those two. Na those two things. Na those things wey you mention fit
He say,
happen to.
okay. He say
Hmm?
inside
So if
stomach. You say now stomach, you see, comes with
inside
itching inside stomach.
imagine.
Imagine.
How inside stomach take dey inch?
I don't know, I swear.
I don't know how inside the stomach take dey inch. um
Yeah.
well, I cannot I don't know. I can
I know,
make I
really,
no
this,
go talk wetin I no know. So I don't
yeah.
know how stomach take dey inch. Yeah.
Your name now waiting, born to win. Your complaint, honestly. Now remember, I beg, listen carefully. This place is not a hospital. This is not a substitute for consultation with your doctor. Because people think that the moment I see somebody put doctor in front of a name online, make I ask him, he go tell me my problem. No, this is not a hospital. There is no way. It's just to clarify, to answer, to guide you, not to treat you. And on your own matter, your question and the way you dey describe, I can't pinpoint. Maybe when you enter hospital, we go fit get more clarity on wetin you dey ask. But say inside your stomach dey itch you, the highest we can talk about is inside my stomach, e dey hurt me, e dey turn me, e feel like I want to vomit, e dey pain me. When you say itching, no vex, abeg. You go need to see doctor, make dem know more about your complaint. Okay, if you never share this live session, please share quickly. Um, let me see. This person, wetin be your name? Your name na Precious on TikTok. Precious, we not dey see your question. That is why I have not taken your question. Wetin be your name? Precious, no name. My question, please. So TikTok is actually taking down your question, and that is why I can't see it, and that is why I'm not reading your question. It's not my fault. I have seen you. You have been here since we started, but I can't see your comments. That is why I'm not reading it. No vex. Okay, there's a comment from Facebook.
Make on Facebook now.
May it come Facebook or YouTube. Huh? We will see you on Facebook and
Mm.
YouTube. Yeah, TikTok now very. Please, my wife always have this complaint. Number one, eye turning. Number two, headache. Number three, vomiting. I have bought so many medications, but still the issue remains the same. What can I do, please? Hi.
You bought many medication. Did you see a doctor before buying those many medication? That's the first question. But if you did not see a doctor before buying all those medication, you may just be buying the wrong medication. And two, did you do any investigation before buying those medication? If you did not do any test, any investigation, and you buy medication, you may just be buying the wrong medication.
Hmm.
And three, how old is your wife? Because sometimes there are some things that may go with age and the situation. Now, every time they complain of this thing, or you get a particular period when they complain of all these signs. So you also need to know whether not every time or you get some particular period, then you need to find out what normally happen that period, wey dey make am when they complain of this condition. Because sometimes if person get head, the guy dey turn them, they feel like vomiting, or some of them go even vomit. Another thing, you want to even find out if e ear dey pain am, eh if e ear dey pain am. Because if you get problem with balancing, because that eye turning now fit mean two things. E fit mean is dizzy, e fit mean say na balance e get problem. So this is the reason why when you go to, you need to see a doctor. I know say most of the drug wey you go don dey buy for this your wife go be blood medicine, vitamins and all that. You want to boost his blood, thinking say na blood na e short. It may not just be blood, it may be far from that. It may even have something in the brain that is making him feel like that. And that is the reason you need to go to the hospital, so that the doctor will see. They will tell her to do some investigation. Now, when you don't do all those investigation, do all those tests, the test and investigation might be expensive, never can tell. But now, when you don't do all those things, they go come know waiting, they go really give her, so that all waiting you talk about, you no go dey feel am again. Mr. Thomas, I hope I am able to answer your question.
Okay. Thank you, Dr. Israel. If you never share, share. If you just they come, you go need to wait, huh? You just they come. People don't they here since. Let me see. Madam Gold, Madam Gold. Hey, Madam Gold, long time. How are you? Madam Gold, no, they follow this my new TikTok page. Let's see. Please, your Facebook name, Dr. Fredostar official, or YouTube, Dr. Fredostar. You can go to YouTube quickly and drop your questions. We'll see them right away. TikTok is blocking your comments. Go to YouTube or Facebook, Dr. Fredostar official. Hmm? This person says, please, doctor, what is the chance of being completely treated of kidney disease if detected on time? What is the chance of being completely treated of kidney disease if detected on time?
Kidney disease.
Yes, yes.
Yeah, if dictated on time, it can be treated completely. So when you detect it on time, it simply means that it should be in this acute phase. And if it's the acute phase, yes, if they give you the correct treatment, you will be 100% fine again. However, you go need to stop some few things, reduce some few things, even some medication and all that. In the acute phase. Some acute phase can be due to some things, can be due to drug, can be due to loss of blood, can be due to some infection, just like that. So when you fit treat all those things come out, the person kidney go dey very fine again and nothing, you'll be like say not even ever do the person. Now only when this person don't get chronic kidney disease. When we say chronic kidney disease, it means say that kidney problem don't deal with that person for a very long time, and it was not detected on time. Now, when this person don't get chronic kidney disease, now sometimes now 100, they dey 100% treatable. It means say this person go they do a lot of, they go for a lot of follow up and a lot of checkup. And with all those checkup, those follow up, that person can live a healthy life as well. And with the routine, when they'll tell her make it they do, and if they do them as prescribed, then the person can live a healthy life. Dr. Fred.
Yeah, thank you, Dr. Israel. Um, let's see. Let's see. Oh my God, questions plenty here. Let me see. I've answered you, Adenike. Please, doctor, what are they calling the doctor that takes care of a woman's breasts? So that is most likely a general surgeon. General, let's say a general surgeon. General surgeon. So if you dey get problem for your breast, most times, general surgeon. However, there are other conditions where the woman fit get wey fit make them invite other doctors. But if the woman get issues for the breast, woman say my body dey disturb me, one thing, we go always advise her to see a general surgeon who go come decide say okay, we need more people enter here and here. So that is the name, general surgeon. Don't panic because you heard surgeon inside. Okay. Let's see. What can cause prolonged catarrh when you have taken all the necessary medication? Prolonged catarrh when you have taken all the necessary medication. So, ma respond quickly. Number one, who dey give you medication? Because people believe that when you just get catarrh, you run and take medicine. Who give you medicine? Who dey give? Na you dey give yourself, because most times your catarrh might just be from your environment, maybe dust, maybe smoke, maybe weather. And if you ensure that all these things no dey around you or with you, your catarrh go go. Sometimes you can even develop catarrh from stress. Your nose fit dey blocked, because but our people believe that the moment you have a problem, it must always be medicine. So who give you medicine? That is one thing we need to know. If na doctor, fine, no problem. Finish your medicine and then follow the advice of avoiding catarrh, because the more you treat catarrh and you get in contact with anything wey go give you catarrh, even cold, flu, all those things, e go bring am back. So take note of wetin dey trigger your catarrh and try to avoid it. Most times, you will be fine. Okay. Let me see. Ah, God, Omo, Dr. Israel. Now, wow, questions plenty. Oh, let's take one question on TikTok. Let's take on TikTok. Okay, let me see this person. Who be this?
Okay.
This person says, Doctor, please, I have fibroadenoma and I also have hernia, and I just discovered that I'm pregnant. Is it advisable to keep it?
Okay.
Dr. Israel,
Yeah, I've talked the question again. Sorry.
I have fibroadenoma. She has fibroadenoma and she has hernia as well. And then she's also pregnant. So she's asking, is it advisable she keeps the pregnancy?
If the pregnancy is not causing you any problem, you not get any complication, you not get any risks to your life, you should leave the pregnancy. Yeah, you should leave the pregnancy. Having fibroadenoma or hernia is not it's not a condition why you will have to remove your pregnancy. So leave your pregnancy. If it grow till delivering, thank God.
Yeah, yeah. Nobody says you cannot keep the pregnancy unless the pregnancy is maybe threatening your life. But your doctor will tell you fibroadenoma is a benign condition. Hernia, you can keep your hernia. So nobody saying you should remove that pregnancy. Huh? Okay. Oh, una not dey share. I have checked on Facebook just now. You no share, but you dey ask me question from morning till night. I dey see you. Let me see. Let me see question again. One more question on TikTok, and then we can go back to Facebook. Who be this person? At the check. What be her name? What is the cause of burning sensation in the groin? What is the cause of burning sensation in the groin? It started after I treated pyelonephritis. Burning sensation in the groin that started after the treatment of pyelonephritis.
Dr. Fred, answer please.
Okay. Now, my greatest concern is how did you even come about that name, pyelonephritis? You understand? My concern, how you take find out this name? Who give you this diagnosis? Because a layman cannot just wake up and say, I happen. But let's give you evidence of doubt. Maybe you went to the hospital and you were treated for pyelonephritis. Fine. Now, that burning sensation in your groin might just be not related to pyelonephritis. It is not related, especially if the itching, the burning sensation, is on top. But if you know that when you are urinating, you feel pain, you feel itching, you feel hotness, and then you're also having this burning sensation around the groin, together with your treatment of pyelonephritis, they might be related. Now, to differentiate the two of them, it's not something we can really say on TikTok because we need to be sure that they are not connected. I don't even know whether you be man or woman, you understand? But irrespective of your sex, burning sensation around that region, we want to be sure that maybe no be your pyelonephritis cause am. Pyelonephritis na infection of the kidneys, and if you dey get burning sensation for your groin, that area of your groin, we want to be sure that no be something wey from that kidney reach there. So we need to be sure and differentiate it. But if na doctor treat you, then most likely no be from your pyelonephritis. So this question is not something um we can tell you here or there. You will need more review. Proud mom of four. I hope I have answered you. Good evening. Why are you laughing? Okay, Dr. Israel, let's see. We have questions here. My God. Okay. Oh my God. Good evening, doctor. Is it possible for fibroid, which is untreated, lead to enlarged abdomen? Your name na wetin? Malai. Okay, fibroid in most women, e no go cause problem. Many women fit get fibroid, my guy, no issues. But some women fit develop fibroid. The fibroid fit enlarge. I'm using this word deliberately and carefully. The fibroid fit enlarge. Go come make the woman look as if say she is pregnant, whereas belle no dey. And people around fit say, this woman has been pregnant for more than 1 year, 2 years, not knowing that na fibroid dey there. So it's very possible that fibroid can make the abdomen enlarge big. And go come make the woman be like say she get belle. So it's possible. Now, fibroid can be treated, but most women love the alternative route. They want to drink one concoction, one herbal medicine, and the truth is that e no dey work. E no dey work. You go spend all the money in this your world, e no go work. By the time you are coming to the hospital, God forbid, you might be coming down with complications. So when women go hospital and we tell them about fibroid and the treatment, they no dey want hear am. They want alternative, and the alternative no dey work. Those fibroid medicine, e no go melt am. E go worsen your problem. But I have given you the answer. Yes. Okay. Let's see. Dr. Israel, are you there?
Yeah, I'm with you.
Okay, the questions are pouring in and we are almost out of time. It says, please, doctor, I'm having pain at my right side of my back. I can't sit for a long time.
Okay, I can't sit for a long time. If you sit down for a long time, what's going to happen? It will cause the pain or what? Will it cause the pain or what? So that one thing we need to know.
Yeah.
Um, And at the right side, it depends on the kind of right side you are saying. If it's the flank area, we'll be thinking is something to do with the kidney. And it depends on the kind of work you are doing. That can also contribute to it. And if you need to sit and you notice that when you sit down, you be like say you don't dey feel small pain, you stand and stretch your back. It is very, very important because sometimes when you sit for a long time, for everybody, when you sit down for a very long time, you must always have that waist pain and pain at the waist region and even the low back region. So try to find out these things. If you not hit that place for anything, or then you not they carry anything where the heavy load when they affect that place, or you know they urinate more often than normal, then and you still they get the pain, please you need to see your doctor. They will need to do some investigation for you, like scan, CT scan or MRI or other stuff to find out if there's anything happening to your kidney and all that, so that they'll be able to treat you very well.
Yeah. Thank you, Dr. Israel. We are almost out of time. Before I continue again, I have a course. Let me talk about my course. Me na relax on content creation. It's a very cheap course. It's 10K, 10,000 naira to help you. You will never regret it. A lot of you listening to me on TikTok don't know a lot about content creation. You see videos, you just speak and you post, and you will get in trouble for that. So my course on content creation will help you, we guide you so that you know how to set up your page, you know what to post, you know what not to post. You understand the concept of copyright, you understand the concept of one viewer and a lot of stuff. The course is very affordable and it will help you. If you're on TikTok, the link is on my page. You can get the course, get it so that you don't regret. I beg, I beg, I beg. If you're on Facebook and you are on YouTube, you can find the link as well, or you can click on send me an email. My admin will give you the details. You make payment, we give you the course. You will never ever regret it. I know why I said so. You will not regret. I beg, go get them so that make you understand content creation. Dr. Israel, somebody's asking us a question on TikTok. Her name is Yaweafe. He says, Doctor, please, I am addicted to eating clay. Please, doctor, help her.
Dr. Fred, I think you've made a video on that before.
Yes, I have. I made a video about clay eating. And most of the comments I got, some women they yab me, say, shut up, you don't know what you are saying. They shut up, I have been eating clay. But it's very dangerous. Very, very dangerous. I'm speaking from experience and I'm speaking from medical literature. It's difficult to stop if you are addicted. But the funny thing I tell ladies where they do and be say, how you go they do something where go definitely end your life. Choose one. Do you want to end your life or you want to keep your life? You say no, they happen, they cause problem. It will cause problem. It can affect your colon, your GIT, it can affect your blood and many other stuff. So what you can do to help yourself, number one, please watch the video. It's on YouTube, it's on Facebook. Please watch it. Number two, avoid anybody and anything that encourages you to eat that clay. Number three, go for checkup. See your doctor because in some cases you might be lacking certain nutrients. There are certain deficiencies that can trigger your body to crave clay. There are certain conditions like this. That is why you also need to see your doctor so that we are sure. Number four, another reason why you need to see your doctor is to be sure that this clay has not caused problems for you. Eh? Here you get. I beg. This is the kind of advice I can give you here on TikTok. So we are almost out of time. Somebody says, "Good evening, doctor." He says, "What do you say again?" He says, "I saw your video about not taking water before surgery. A lot of people here are ignorant about this. Please help mention it again." Hmm. Okay, let me say something about it. Now that video is short, and I said it that is bigger than that. Any form of accident, whether gunshots, whether road traffic accident, motor accidents, motorbike accidents, you fall from heights, you understand, accident, or you notice the person is even vomiting blood, any form of accident whatsoever, don't give anything to drink, whether water, whether soft drink, whether energy drink, whether any drink, don't give. Because if that condition is really severe and that patient needs to go for surgery, we always want the stomach to be empty. Because if the stomach contains food, whether water, whether rice, whether bread, whether it can lead to complications. But our people are not aware, and this stuff has ended the life of so many people. So don't do so. Another thing I mentioned in the video again is that when you are involved in an accident or you see someone involved in an accident, don't celebrate immediately and say, thank God, though, this person no buy. Encourage that fellow to go for medical review, medical checkup. Because some people can be bleeding internally. A lot of people have ended their life. Oh, just had an accident and you will find there is no obvious bleeding, but the person is bleeding internally. The person goes home, lies down, and never wakes up again. This is why Africans need to know about this and so many other stuff. So I don't know if Israel wants to add anything to that before we round up.
No, no, not really.
Okay. Um, is the link for the training here? Okay. The link for the course. Sorry, no vex, I beg. The link for the course. I will drop the link again to everybody on Facebook that wants to get the course. Just comment now. I want the link. I will respond to you now. Or to put you on a safe side, so that some people will not respond to your comment other than myself. Send an email to the message on your screen. Just send an email. I want to get the course on content creation. Please send me the link. My admin will give you the link, or we give you account for you to pay and we give you the course. So please, if you know you want to get the course, I'm serious, so I'm not begging, no, because people want you to come on the internet and beg them. No, I'm not begging because I'm not desperate. I want to help you get the course, and you will never regret. Dr. Israel, any final words?
Okay, I want to say a very big thank you to everybody when they follow us and they listen to us. You guys are you are the best. You are very important to us. And because of now we day here, because of you now we day here. If not be you, we for not be day here. So continue to listen to our videos, continue to ask questions, and we'll do our best to always give you the correct or the right answer. Yeah, there are so many questions we didn't answer today. I know. And some not be our fault. Some maybe time because of time. Why some is because some of the kind of questions just when some people they ask. Now question when be like say they just want to give them diagnosis and treatment. So when we perceive those questions like that, we will likely not answer those questions, and some is just to tell you to go and see your doctor, who is the right person to give you the treatment and to tell you other things that you need to do. So once again, thank you so much, Dr. Fred. Thank you for always starting the program before I join. Thank you, thank you, thank you.
Yeah, Dr. Israel, thank you so much and congratulations to you and your family. Huh? Yeah, congrats, Dr. Israel. And yes, somebody says, Doctor, I tagged you in a video. You didn't see it. I beg, no vex. Let me use this message again, opportunity to apologize to you. We cannot respond to everybody. We cannot respond to all your messages. We cannot respond to all your tags. I swear to God, easy. That is why we did try to come online like this to the answer. So no vex. I don't see the tag. Plenty people they tag me, but I know the see am. And no vex. And what again? We'll be here again next week, Sunday, by 8 p.m. to 9 p.m. on this platform. We have been doing this for more than 5 years by the grace of God, and we pray to God to give us strength not to stop. Share, invite your friends, click on the follow button, and like I always tell you, good life now waiting. Good life. Na
Now
sense.
sense.
Take care and have a wonderful day. Bye bye.
Yes, that's the email. That's the